Thanks for tuning in to our live stream, Prostate Health for Men. You could be 25 saying this is not for me. Wrong, because men in their 20s already begin to show signs and indicators of prostatic changes. I'll explain. By the time you're in your 30s and 40s, depending upon your lifestyle, how much alcohol you consume, the quality or lack thereof of your diet, the conversion of testosterone to dihydrotestosterone, all of these factors, plus a lot more, enter in and factor into enlarging a man's prostate. Years ago, if you go back to the 60s, all the way back even to the 30s, 40s, and 50s, resection, virtually going in through the penis and going in and literally scraping out the tissue of the prostate gland was very common. Today, not quite as common. Medications are used more, but there are still men that have to undergo this procedure because of enlarged prostate glands. Problem is problems with urination, bladder retention or urinary retention to the bladder enlarges the bladder, chronic prostatitis or irritation, even sometimes infections are more chronic. It is a huge issue. The real problem is that it's guesstimated that over the next probably 7 to 10 years, the men with prostate enlargement or prostate-related complications, even prostate cancer, is expected to double. So this teaching is designed to try to point out the areas of why we're headed with an upward climb in prostate-related issues and enlargement of the prostate gland. You could be 30. You need to be aware of this because before you know it, you'll be 40. Before you know it, you'll be 60. This is an issue. It doesn't just, when the symptoms manifest, 50, 60, 70, that doesn't mean that's just when the ball got rolling. That ball got rolling back in your 20s and 30s. So let's cover a couple of quick topics and let's help you reduce your potential symptoms. Certainly we have supplements, zinc essentials, prostate plus essentials, or an option, a more intermediate step to the more potent version, saw palmetto plus. Amino acid combinations. We have supplementation to help you in this area. But we want to define for you first the things that you should be aware of that are more lifestyle. Number one, big relationship to prostate health, or what we would call BPH, prostate enlargement. I'm even going to throw in here prostate cancer. Now, don't confuse the two. Just because you have an enlarged prostate doesn't mean that's why you have prostate cancer. There are many other factors. But I'm going to encompass prostate health, enlargement of the prostate, and even prostate CA, cancer. I'm going to talk about them in general terms. Now, why would I say that? I don't want to be confusing. Why would I say that? Because many of the factors are consistent throughout these three areas. IR, not code word for whatever. It's insulin resistance. Insulin resistance means I am eating too many of the wrong types of foods, my common theme, too much white, processed, sugar, too many bad fats, not enough whole foods, live foods. I spike insulin levels. As my insulin levels rise, that encourages insulin resistance. That problem is related directly to prostate health and enlargement. Number two, weight issues. A man that's overweight typically is producing a lot of inflammation from his fat or adipose tissue. He's converting much of his testosterone to estrogen. That will irritate and enlarge the prostate. So we have two key factors involved in enlargement of the prostate: weight issues, metabolic issues, how I eat, that directly influence enlargement. We'll just say prostate health in general, and potentially leading to prostate cancer. Number three, chronic inflammation. Chronic inflammation, I love my wings, I love my beer, I love gravies and those types of sauces. I grew up on meat and potatoes. I don't like vegetables, fruit, whatever. I'll eat an occasional apple. That whole conundrum, eating a pro-inflammatory diet, enlarges and aggravates and antagonizes the prostate gland. Fourthly, I mentioned testosterone that converts to dihydrotestosterone. This is a natural process. The body converts to DHT alpha DHT beta. Now, this is involved in loss of hair for men, prostate enlargement. You're going to do this. Unfortunately, if we're doing, I kind of always get these confused, but I hope I have it right. If I'm converting to the toxic side of the DHT metabolites, that will absolutely enlarge the prostate. Is DHT evil? No, not really. It is necessary for men to produce adequate levels to be able to function from an intimacy standpoint with erectile issues. Without DHT, erectile function is minimal. Number two, I can convert this testosterone to estrogen, estradiol. Big problem. And that usually happens with insulin resistance. I'm overweight. I eat a poor diet. I aromatize from my fat cells, my testosterone to estrogen. All of this begins to enlarge and antagonize, irritate, and inflame the prostate gland. So we've covered a couple areas. This is a naturally occurring process, but we need to limit it. This is a naturally occurring process. A man needs to make a small amount of estrogen. We need to limit it. Next, heavy metals. That is a big area that is, I know that I want to completely cover in a mini version of Prostate Health for Men, but heavy metals, cadmium, lead in particular, cadmium, big antagonizers to prostatic health. Prostate health in men is very much driven by the utilization of nutrients that aid repair, antioxidants coming from foods, good fats, and in particular minerals, selenomethionine, selenium, zinc. Heavy metals can interfere with these components. They're bullies. They interfere metabolically with the use of good minerals and can cause an enlargement in that tissue. Zinc is found in very, very high concentrations in the prostate gland of men. Next, I mentioned the diet. More specifically, a diet that is high in saturated fats. So a man that loves processed luncheon meats, a lot of saturated animal fats, a lot of dairy, just love a lot of meats and a lot of protein, not much in the way of vegetables. You eat a lot of saturated animal fats, that will encourage this whole process. Lastly, most men are in what we call repair deficits. So now, as I look back through this, you say, wow, well, this is just way too much for me to absorb and consume. How am I going to? No. If you eat poorly, and that ties right down here, if I eat poorly, I've got to be able to reduce insulin resistance by changing my diet. I must lose weight. If you're overweight and you're viewing this or you're watching this for a spouse, if you're overweight, it doesn't mean everybody that is thin or normal weight, or that, it doesn't mean that someone is thin, normal, never can have prostate issues, because this is multifactorial. This is why sometimes when I do these teachings, they can seem confusing, but they're really not, because you can't just look at this as the one issue or just the one issue. Often it's a combination of issues. So if you're viewing this for a loved one, for your husband, he has to understand that if he's overweight, that has to be an area that has to be dealt with. Number three, if he's in an inflammatory state because of a very poor diet, for all the reasons that I've mentioned, he's going to encourage prostate enlargement. And if we work all the way down through this, now most men, if you have a lot of this going on, a poor diet, I don't eat well, I don't supplement well, I have a repair deficit typically, meaning the body doesn't repair well. The prostate gland, you won't hear this from your medical people, but the prostate gland is in high need of repair, no different than any other organ and function in the body. Lack of repair or repair deficits will encourage damage to the prostate gland. What about your vitamin D levels? Does that play? Well, it plays more to prostate cancer. We know that men that have vitamin D levels at 50 nanograms per milliliter or less, or I forget if it's milliliter or deciliter, are at a higher risk for prostate cancer. Okay? So all of this begins to show us that I can modify the potential. So you could be 30 right now, or you could be 65, or your spouse or whatever, and you say, well, I don't need to worry about it here because I'm too young. I'll worry about it later. Once the prostate gland enlarges, you're going to have some minimal options. TURP, transurethral resection procedures that go in and literally cut away the prostate tissue. It's a pretty gruesome procedure. Complications sometimes ensue. Infections, neck of the bladder is stretched. Urinary incontinence many times is common for years, and often scar tissue develops, and sometimes they have to go back in. They use microwaving procedures now, or radio frequency waves that go in and attempt to burn the tissue. It's not believed to be as effective as the resection or the cutting away, but these are invasive procedures. They're considered minimally invasive. I consider them invasive procedures. So why would I roll the dice and say, well, I don't have any problems urinating right now. My prostate gland is not enlarged. I'm 30, 35, or 40. But you are often building to a crescendo that will eventually hit a point where you begin to experience symptoms, and now you're going to be attempting to peel away the layers, which is often pretty difficult. Don't wait until you're 65 or 60. Begin to be proactive now. Lifestyle, diet, loss of weight, reducing inflammation through the diet and supplementation, reducing conversion. You say, well, I don't know how to do that. Well, everything that I'm kind of teaching you kind of encompasses and relates to that. Prostate health in men. You say, well, does that have to do with infertility? No. Prostate gland, it's important for you to understand because it carries the fluids that carry seminal activity. So you know that it's part of man's health, basically. Let's move on. What are some foods? Avocados, very important. Drink green tea, eat some avocados, a real basic approach. Pomegranates. If you like pomegranates, you should try to buy some fresh pomegranate occasionally. How about unsweetened pomegranate juice? Not a bad idea. Great for the cardiovascular system, great for the prostate. Walnuts, sunflower seeds, pumpkin seeds, all very good for man's prostate health. Reduce the amount of dairy. Organic only if you do. Reduce the amount of saturated animal fat. You've got to consider it. Eat more fish, less red meat. Doesn't mean you don't eat red meat, but you need to change. If you're going to eat red meat, it should be grass-fed predominantly and hopefully not as much corn-fed. It fattens the meat, marbles the meat, produces inflammation in us. Cruciferous vegetables are critical. Broccoli, cauliflower, olive oil, very, very important as well. Think about some ground flax. Maybe add some ground flax to some steel-cut oats. So as we go through this, seeing that this area right here, I believe this is critical because too much of our population today, this is where we're headed. We're insulin resistant, and what we don't realize is that stimulating insulin-like growth factors, which can promote enlargement of the prostate as well. I just want you to kind of think about this approach and the health of it. Prostate Plus Essentials is our go-to. In my opinion, I think it's an excellent product because of numerous ingredients. The right forms of saw palmetto, standardized extracts, Serenoa repellens, about up to 50% reduction in conversion of testosterone to dihydrotestosterone. Lycopenes, we use the free form in the doses documented in studies to be helpful to the prostate gland, can reduce the amount of free radical damage to the prostate by up to 40%. We also know that African pygeum, which is in this compound as well, can reduce by up to 15% damage to the cells and the cell structures and improve membrane health. Urtica dioica, which is stinging nettles, can also influence the repair mechanisms. Remember I told you repair deficits can improve repair mechanisms in the prostate gland by up to 15%. Zinc essentials critical here. Zinc is probably is the most important. Selenomethionine, number 2, zinc, number 1. Why? One of the main areas, it's an enzyme activator, and it reduces the amount of 5-alpha reductase, which is an inhibitor of conversion of testosterone to dihydrotestosterone. Prostate Plus Essentials, Zinc Essentials, change your diet, lose some weight, be aware of these components, and men, you have a healthier prostate, less complications. You don't want to go under the knife for this one. You don't want to be nuked and microwaved. You don't want to be on the medications to treat an enlarged prostate. They have lots of side effects. Make the choices now to prevent 10, 15 years from now, because believe me, it eventually comes. God bless you. Thanks for viewing the video. I hope it's helpful to you and your family. Be blessed.